Welcome everyone, this is Dr. Jaitly, your cardiologist from New York on your social platform site, Muni Health, your favorite website, which is actually dedicated to medical fraternity in general, and then of course to your general masses as well. So we're combining the two in one here, wanting to find a great information for all of you through medical education as well as patient education to improve the clinical outcomes, as you know. And we know that the clinical outcomes are actually enhanced, if you will, by combining these two, because it's been clearly shown by numerous studies now that patient education is so vital to our improvement, not only just by medically educating the doctors, but also medically educating our patients in a very, very simple form, because you can improve the compliance factor, you can improve their understanding about the medications, their understanding about the tests, their understanding about following the for follow-ups and adhering to the recommendations that the doctors like to make. Okay, so without any further ado, I'd like to delve into the subject matter today, being the new definition of hypertension, as has just come to know of only in the last couple of days at the American Heart Association meeting, which concludes in November of 2017. Now we have a new definition for hypertension, by the way. And the new definition says that anything over 130/80. Now, mind you, this is a totally new finding here. That'll include hundreds of thousands of patients across the continent and then perhaps millions all over the world. Anybody more than 130/80 would be included as hypertensives now. So it doesn't mean that you have to start panicking, running to the hospitals, to the doctors, etc. But the whole idea is I'll just recommend exactly what you should be doing. Okay, so being a preventative cardiologist all my life, and of course practicing patient education through my global initiative, I would only recommend that the new definition, hypertensive patients should start their lifestyle modification right away. But before you do that, you should be able to go and check your blood pressure at a pharmacy, at a local corner pharmacy, if you will. You can go to your schools or to your colleges, if you will, if you're younger students and professors and teachers, and I'm sure they have their employee clinics at your workplace, etc. So you can go there, have those blood pressures checked right there. And then, of course, if you do not have any of that access, just go to the MD clinics, doctors' clinics, and they will be able to check your pressure. So first, get your pressures checked. And if your pressure is more than 130/80, then by all definition means you're hypertensive as of American Heart Association November 2017 criteria now. The old definition being 140/90. Now, that's forgotten now, so just cross that out, because now we are including even 130/80. In other words, we are trying to be as stringent as possible in isolating some of the asymptomatic hypertensives that's probably are lurking around in tens and hundreds of thousands of numbers all over the world. And they are possibly like within the submerged iceberg, if you will. So they actually turn out to become the bigger moderately hypertensives and later on severely hypertensives and develop target organ damage. Now, very important. Why do we worry about high blood pressure? Well, it's so important. Let's draw the favorite diagram here. This is my heart. Here's the aorta that's coming out. So quickly, as we see, we have a coronary which is going, this is the left anterior descending, a left circumflex goes around the left heart border, and then the right coronary goes around the right heart border. And there are numerous branches that will offshoot out of here, very importantly, and one sees that. And so you can see these branches. They all come down to the apex of the heart, which is right here. So in other words, the apex probably gets supplied by all the three arteries, if you will. So it's a very, very important organ, and obviously that's where the left ventricle sits. So now aorta is sending oxygenated blood to the rest of the body, as you know, but the heart saves its own blood supply, and it supplies to the coronaries, these sets of coronaries. So the coronaries, if you will, they are basically like arteries here, for instance. And because these arteries, they tend to have their own plaque formation that can start very early. In fact, at the age of 15, 20, it has been shown. These plaques can form as a result of the lipids, as a result of smoking, as a result of drinking, as a result of bad habits in your diet, and of course the family genes. So all those cardiovascular risk factors that I just enumerated will be responsible for these plaques. So as a result, the arteries can harden, and therefore the hardening of the arteries result into high blood pressure, just so that you know. So the high blood pressure is a result of the hardening of the arteries. And what takes the brunt? The heart takes the brunt. And what other organs will take the brunt? They are the kidneys, for instance. Now, if you were to look at the kidneys here, and we'll draw a right kidney, slightly lower than the left kidney, if you will, and because the liver exists on the right side. So, so you have a right kidney here and then the left kidney here. And both the kidneys will also suffer the same damage, if you will, in a similar fashion, just like the coronaries here the arteries will suffer. Likewise, the aortic plaques can be seen right within the aortic wall here, if you will, and they can start very early on here as well. So those are called atheromas. So throughout the cardiovascular tree, this atherosclerosis is the mechanism which is responsible for high blood pressure, is also responsible for coronary artery disease, is responsible for, as I said, hypertension, it is responsible also for your stroke and the renal disease, if you call it chronic renal disease, and then the peripheral arterial disease. So all of the vasculature diseases, they are resulting from atherosclerosis, and all these various vascular trees are involved. So the point here is now the National American Heart Association, if you will, has come up with the guidelines where they say that even 130/80 more than that pressure is actually injurious to health. So they are isolating these patients now who are totally asymptomatic. Remember, these patients are asymptomatic. They have no symptoms whatsoever. And if they have symptoms, of course, they'll report to the doctor rather early, like headaches and anything else that's like a diminution of vision or shortness of breath or chest pains, then of course they will present. But asymptomatic is the way to go in these 130/80s, most of these individuals and above. So as a result, these patients must be screened rather quickly. So lifestyle modification comes into play right away, where a weight reduction is required. If your BMI is 24, ideally, you're good. If it is more than 25, and between 25 to 29, you're overweight. More than 29, obviously, you are grossly overweight, and perhaps over 33, as they say, then you're grossly obese. So remember that. So your BMI should start moving in this direction. Exercise, they're recommending that 30 minutes, roughly 3 times a week, should suffice if you're not exercising at all. But if you're already doing it 3 times a week, try to speed it up to 5 times a week if you can. And very important, no smoking sign is on again. And remember, 1 pack of cigarettes that if somebody was smoking, that will increase your blood pressure by 10 to 15 millimeters mercury on a pretty much 5 to 10 years basis. So hypertension is linked to smoking directly. Drinking is linked to smoking. If you're having more than two drinks a day, that's going to cause a huge problem. So again, no drinking at all, and especially because drinking is certainly addictive and smoking is certainly addictive. So I normally say no smoking and no drinking. Don't settle for one drink, and don't settle for 1 or 2 cigarettes, because the chances are you start with one, you go on with and then till it's endless. So the whole idea is wanting to see if you can modify these 4 lifestyle modifications: weight reduction, exercise to be instituted 30 minutes 3 times a week, no smoking, and no drinking. Now many a times with lifestyle modifications, you will be able to get the pressures down from 140/90 to 130/80, or even less to 120/70, for instance. Okay, but if the pressures are very, very high, 150/95, 150/100, the chances are lifestyle modifications alone will not work. So you need to get the meds going. Some meds will have to be prescribed. So again, you may use a diuretic. A doctor can prescribe you a diuretic, or can prescribe you a beta blocker, or can prescribe you a calcium blocker, if you will. And there are numerous drugs which we have addressed in other video formats for you on Muni Meter Health. But the whole idea is wanting to see if we can introduce you these new guidelines that have just emerged from American Heart Association in this month, November of 2017, to define the new hypertension range now being more than 130/80. And that's the news of the day today. So stay tuned for more as it's coming through. So we just wanted to tell you that lifestyle modifications alone can modify your blood pressure and bring you back to normal. And again, asymptomatic blood pressure is very, very problematic, because you don't have any alarming sign, and it's a good idea to go and have yourself checked at a pharmacy, a school, a college, an employee clinic, or a medical office. And as I said, the coronaries can be involved, and stroke can be prevented, and kidney diseases can be prevented, etc. And so also the peripheral arterial disease can be prevented if your pressures are below 130/80 now by the new definition of hypertension as recommended by American Heart Association. So thank you again. This is Dr. Jaitly. So long, and I'm here at Muni Meter Health for all your questions, suggestions, and comments. So please feel free. Do like the button if you will, and we know that then you're watching it, and of course put in a comment if you will, and that'll greatly help us also. Thanks again. So long.